What is swallow dysphagia? Dysphagia is a medical term that refers to difficulty or discomfort when eating or drinking. It is also referred to as swallowing disorder because it can cause problems with the process of swallowing food and liquids. People who have dysphagia may experience pain, gagging, coughing, choking, and other issues while attempting to swallow. Anatomy of swallowing, understanding dysphagia. Dysphagia, or difficulty swallowing, is a common occurrence for many individuals. While the symptoms may vary from person to person, understanding the anatomy of swallowing can be an important part of addressing and diagnosing this condition. The process of swallowing involves several muscles and other structures working together in order to facilitate movement from mouth to stomach. The act of swallowing begins in the mouth when food or liquid is mixed with saliva before passing through the throat into the esophagus. Here, pharyngeal constrictor muscles compress it forward into the esophagus in order to reach its destination at the stomach. Causes of dysphagia. Dysphagia is a medical term used to describe difficulty in swallowing food and liquids. It is a common symptom of many different medical conditions, including neurological disorders and diseases of the esophagus. One common cause of dysphagia is neurological disorders such as stroke or brain injury. Injury to any part of the area responsible for controlling swallowing can lead to weakness or paralysis in the muscles, which affects an individual's ability to swallow safely and efficiently. Signs and symptoms of dysphagia. The most obvious symptom of dysphagia is difficulty in swallowing solid foods, liquids, and even saliva. People with dysphagia may experience a sensation of food getting stuck in their throat or chest, coughing during meals, taking several attempts to swallow food before being able to do so successfully. Diagnosis and treatment for dysphagia. The first step in diagnosing dysphagia is taking a detailed history from the patient about their symptoms and any relevant medical history. A physical exam will then be done to assess the patient's ability to swallow, as well as any associated facial or neck muscle weakness or atrophy. Imaging studies such as X-rays, MRI scans, CT scans, barium swallow studies, fiber optic endoscopy may also be necessary to help identify any physical obstruction that would be causing the problem. Nutrition considerations for dysphagia. Nutrition plays an integral role in managing dysphagia as it can help reduce symptoms and improve overall health outcomes. In individuals with dysphagia, nutrition considerations involve choosing food items that are easier to swallow and digest. Soft and pureed foods are typically recommended for those suffering from swallowing difficulties as they require less effort to swallow safely. Additionally, thickened liquids may also be used to prevent aspiration or choking while drinking. Nutritional supplements may also be recommended if the individual has trouble consuming enough nutrients throughout the day due to their dysphagia symptoms. Coping strategies for dysphagia. One of the most important coping strategies for dysphagia is changing one's diet. Eating softer foods and avoiding acidic and spicy ingredients should help lessen the difficulty in swallowing. Consuming more liquids than usual may also help lubricate the throat muscles and make it easier to swallow. Additionally, sufferers should try taking small bites of food instead of large ones and chew each bite thoroughly before attempting to swallow it. Conclusion: seek medical attention. The article on dysphagia, meaning difficulty swallowing, has explored all the components of this medical condition. Dysphagia can cause pain while eating and drinking as well as an increased risk for aspiration pneumonia due to food particles entering the lungs. Fortunately, there are treatment options available such as exercises that strengthen throat muscles, medication for nerve damage and infection control, lifestyle changes such as changing one's diet to increase ease of swallowing and reduce risk of choking, speech therapy to help get used to different textures and consistencies in food items consumed orally.